Hi, welcome to Arizona Metro News. My name is Corrine Zalot. I am your host for today. And today we have a special candidate with special guest with us. He is a congressional candidate for District 9. His name is David Giles. Please welcome Dave Giles to the show. Hi, Dave. How are you?
I'm doing great. We're getting better every day. Thank you for having me, Corrine.
Thank you for being here today. We are excited. So you are the Arizona congressional candidate for District 9, correct?
That is correct, yes.
Awesome. So I'd like to start out a little bit with just getting some information about who you are personally. I understand that you have a fairly extensive resume, educational background that makes you a great candidate for this position. Do you want to elaborate a little bit on that for our audience?
Well, yeah, I have extensive educational background and a business background, both domestically and internationally, and that will help me represent the people of Arizona better. I also follow, Christian values that'll help me represent in a good, faithful way for our people in District 9. I want to, the government trust me, the state trust me, and I want to earn the trust of the Arizona people in CD9. I want them to trust me as well. Go ahead.
Wonderful. Thank you. Yeah, I understand that you had some technical training and Christian-based training as well as you're business-oriented. So that does sound like a great combination, sort of the trifecta you have going on there. So one of the first areas that we wanted to discuss was healthcare. You wanted to talk about that a little bit. It sounds like you have some great ideas about publishing the cost and making it affordable. First, let's go ahead and talk about what your ideas about full disclosure and publishing the cost. You want to elaborate on that?
Well, this is one of the areas where we go to private business and companies, and for the people to be able to shop around, you need to publish the cost of procedures, have full disclosure and transparency. And with one company or one place, one hospital might be able to do it a little cheaper for you and save you some money. You should be able to have the ability to choose. Keep government out of it and let you choose for your healthcare and your provider that you want to have.
I like the idea of getting the government out of it. It seems like right now we have the government in it pretty deep, and it's kind of making a mess of things. So you're also talking about being able to carry your health insurance across state lines. Would you like to elaborate on that? How is that different from what it is right now?
For a lot of places right now, there's two categories of this. First off, I would want to have you or us people to be able to buy insurance from any healthcare provider that we choose. If you have one in California that's going to provide you better service at a better price, or one in New York or one in Texas, you should be able to buy health insurance from those companies. As well as, if I transfer, not transfer, but if I carry across, move to Texas or move to New York, I'd want to be able to take my healthcare with me so that I could cross state lines. So there's two factors to that we want to be able to provide for people so that they can keep their plan and keep their provider, keep their doctors.
Okay. So would your policy recommendations include still covering pre-existing conditions? I know that was a pretty hot topic when Obamacare and other policies were being debated. What are your thoughts on that?
Absolutely. You got to have pre-existing conditions. I mean, it's something that, I'm going to say you need to have it because, as an example, if I worked for, a company A, and I transfer over to company B, and they got a different healthcare plan, but I have an existing condition that's covered on healthcare A, I want to be able to take it over to healthcare B and have it existing. And if I start up, with a healthcare program, you ought to be able to have healthcare, even though you do have pre-existing conditions. We need to cover everybody. You can't exclude people out and set them aside. It's just not going to work. We got to cover everybody.
Right. Okay. So would you be wanting to push for doing away with the current Obamacare that was attempting to cover everybody, or would you kind of build on that and modify that in some ways?
I really think we need to let Obamacare go and start fresh and start new and build a fire under the people in Congress and get together and work with some companies and find a way where we can provide affordable health care to everybody. We want to make it competitive, so you got to keep some of the restrictions out of it. And there's no reason why I should have pregnancy insurance for myself, because that's just not going to happen. So be able to tailor our plan to fit what we need.
Okay. What about situations like right now we're dealing with the COVID pandemic, and it seems like from the WHO, that is CDC, to the Trump administration, it seems like it's kind of been a little bit of a mess. There's a lot of conflicting information that's coming across from the different organizations, from the WHO to the United States. What do you see would be beneficial to do differently?
Well, we need to be wise, be smart. Go out on the internet, look around, and get good information. Look at your state values, the information that they're publishing, and you got to be careful, because there's a lot of bad information that's going out there about the virus. And when it comes to businesses, all the businesses want to thrive and prosper. So business will do the distancing, they'll wear the masks, they will do whatever it takes to be able to be in business. Because if they mess up and you have a big problem in there, the customers will stop going and they're going to lose business. So people are not dumb. They can stay apart from each other. They can choose to wear the mask. They can not choose to wear the mask. It's your responsibility. It's our own personal responsibility to take care of us. We can stay home or we can go out. We can go out to dinner or we can have it brought in. Right now, takeout and delivery is very popular. And it's one of the fastest growing businesses that we have right now. But we need to be smart and do smart things, because also different counties, different states have different rates. I mean, there's some of the states in the Midwest and the North that have virtually no coronavirus people that are there. So you can't have a one policy fits all. We just need to be smart about it. Our businesses will be smart about it, and trust one another.
Okay. I know I've had previous conversations with other medical experts as well, and they talked about their frustration in terms of wanting to, have doctors want to be able to utilize the protocols that they know would be effective in the treatment. And their hands are tied in a lot of ways, because there's been a national protocol sort of put in place, which was, related to acute respiratory distress syndrome, using ventilations and things like that. And they're finding that it's actually not as effective as getting it treated earlier on. But those are some ways in which the government kind of did this blanket statement of, this is the protocol, this is how we're going to treat this. Whereas doctors want to be able, like you said, get the doctors out, or get the government out of the doctor's offices. Because they want to be able to use their medical training and their judgment and treat the patient based on their individual presentation. Do you have any thoughts about that?
Well, yeah, it's one of those things where, one blanket doesn't fit all. One policy doesn't fit all. Okay, and that's where you get, our federal government mandating down something. It doesn't fit all of the states. This is something, we need to relegate to the states, the doctors, and the professionals that are in the area, because they can tailor fit it straight to their area, to their people, to their sicknesses that they have, and the number of patients that they have. We have plenty of ventilators available. We got plenty of hospital space available. In fact, we've even began doing some of the elective surgeries because the space is available. And that's also bringing our people back to work and helping our economy again.
What do you think? One of the other things I hear from a lot of medical professionals in particular is that there's still not enough protective equipment, PPE. They don't have masks. I'm a nurse, and I've been trained that, you wear an N95 into the patient's room, you come out, you take it off, you throw it away. You put on a new one, you go into the other patient's room, you take it off, and you throw it away. So theoretically, you'd be going through, 10 N95 masks in a day, depending on your patient load. And right now, a lot of doctors and nurses are only wearing one N95 mask for the entire 12-hour shift. And then they have to wear that same mask for the entire week or the 3 shifts that they do. And as a result, there's been a spike of a lot of doctors and nurses getting sick. In fact, I think statistically they showed about 600 medical professionals that died in the United States in the past 6 months. And so that's a concern. I'm wondering why maybe the federal government didn't enact having mass production of masks so that hospitals would have more PPE for their medical staff, or is there anything that can be done on a state level?
Well, it's my understanding that we've got some companies that have began building these masks in mass, and we're getting many of them out there. I haven't got the numbers with me right now, but they're building masks. Factories have converted building masks. They've converted building sanitizers. But and the one that I've noticed, you can recycle. They cleanse it, and they can use it like up to 10 times. We should be able to use those masks as well. But if there's a shortage of masks, we need to ask, our federal government where they are and get some to these people that have the shortages. Because as of right now, I think we're building more masks than what we need, and we're giving them away to other countries. So if we have a shortage, we shouldn't be giving them away to other countries. But I need to check our facts on that. If some of the people are actually having shortages, they need to go ask the government to get some more masks, because I believe they're available. And the recycle ones are good. I think it's kind of like one of those other breathing devices. You put it in a box for a couple of hours, and it brings the temperature up, brings the steam in, or whatever it does to clean it out. But that was advertised, and you can get about 10 times the use out of that. But yeah, you don't want to go through like a handkerchief. We've done away with handkerchiefs because all you do is recontaminate yourself. We're going to Kleenex or something like that, one of the tissues. But yeah, if we can sanitize our masks and reuse them again, they'll last for a lot better on. But we should not be short of masks anywhere or any of the PPE equipment.
I wonder if that may be a state level issue then, if maybe perhaps Governor Ducey is having some problems. I haven't looked into that component of why there is a shortage in, I believe it's Banner Hospital in particular that was, that I've read that was running up against shortages and a spike in patient load. So it may be something
researching and find out, because if we're giving them away to other countries, and we got that many of them, there's no reason to have a shortage in Banner. Maybe Banner's got to ask the governor, or Banner's got to ask Trump, or the committee that he's formed.
Yeah,
the virus committee. But there's, like I say, if we're sending away to other countries, we should have plenty to give to Banner.
Right, I agree. Thank you.
And I would, if I was in Congress, I'd be asking them for, if you got a problem, I'm going to be, straight on the team's phone calling these guys, say we have a need now here.
Good. So it's good to know that you would be advocating for the medical professionals. I think that that's really important, especially because we don't see COVID going away anytime soon. And our state in particular is really seeing an increase in numbers. And I think it's important. Otherwise, if we continue to lose medical staff, then who's going to take care of the patient?
We're in trouble. I fully support our medical staff. All of our first responders, the police, we can get into that another time. But our medical people, they're doing an exceptional job, and they're putting their life on the line for us, me. It maybe not me personally in the hospital, but they're curing people and taking care of people as soon as they can so that they don't come around and contaminate and hurt me. So it's helping all of us to take care of our medical staff as best as we can and pay them well.
Yeah, thank you. Is there anything else that you want to discuss or mention before we wrap up the show? Because we are coming to the conclusion of the show, and it sounds like we've covered the cost effectiveness aspects. And
well, I want to go and work with whatever team we've got to work with to get affordable health care for all of us out there, including the pre-existing conditions, and don't leave anybody behind. And you brought up the topic about taking care of our doctors and nurses. And when I have a procedure done, I get all the doctors and nurses down the table before, and I pray for them, not for me, so that they are smart and they the knowledge that they have, the wisdom that they have. We want to take care of these people. Now, I want to send out a personal thank you to all of our doctors, nurses, and staff, everybody that's working in this field, even in the nursing homes. We got to take care of all of our people, and I'm saying thank you very much. Thank you. I can't thank you 100 times enough.
Mm-hmm. Thank you. All right. Well, thank you everyone for tuning in to today's show. That is Congressional District 9, Arizona District 9 candidate David Giles. He is running for office this year, so please do consider voting for him in the future. And that concludes our show for today. Thank you and have a wonderful day.